Without further ado, I'll invite Ash Patel to come up, who's going to talk about how to stay academically minded in private practice.
All right, thanks for having me, Jason. So here are my disclosures. The only relevant one is that I receive research money by Globus Medical. So academically minded can mean different things for different people. And you could be like my 3-year-old who constantly asks why, and have a curious mind. But this student-mentor relationship is also a pretty interesting one as well. Maybe you're into product development and working with industry. You like to read and write, critique, outreach work, I think is underappreciated as well. Mission work can be very satisfying. What we're doing here, society involvement, talking, ideas, thinking, coming together. Teaching, and then what we all do, lifelong learning. And, when you're at an academic center, there's resources around you, there's a culture of academics, conferences weekly, case presentations. But when you're in private practice, that's not the way. Generally speaking, it's a culture of clinical medicine. Taking care of people as best as you can, making sure you're putting out fires when they arise. And, there's not a culture of pausing, thinking, reflecting, because it's about productivity. And if you don't work, you don't get compensated. So, all those elements that we discuss could mean academics. And if you do have a private practice setting, you have to be intentional about the way that you introduce those things back into your practice. And for me, that starts with tracking. If you want to lose weight, you've got to track calories. If you want to get better at something, you've got to track those elements. And for me, like Residency was the first form of tracking, where you have this leather-bound book, you put your case on there, you write in like what surgery you performed, you log those cases, and to make those numbers, and that's the first form of tracking that you have. Well, it's the same when you enter practice. Now in my practice 10 years out, we track a ton of things. We're tracking the patients, we're tracking the intra-op data, we're tracking the imaging pre and post, we're tracking outcomes. And it takes coordination between the different team members in order to achieve that, because again, you don't have the resources like you are in academics. You're relying on an MA, a nurse, maybe a PA, and yourself. And so the coordination is around making sure that somebody is entering this into a password-protected, maybe encrypted file. It could be as simple as Excel. That's how I started. And really, it was just a way for me to understand volume, the amount of surgery that I was doing in each element, like coding a T-lift or a lateral. But now it's become a little bit more sophisticated, where the rep is helping with the intra-op data, and then all that stuff gets passed. And the last couple of years, we've had a research fellow, and so that's immensely helped with our program to kind of put all that and accumulate all that into a database. And so going back to all the things that you may be able to track, if you're by yourself and you're early in your practice or thinking about you want to track, well, start simple. I mean, you don't have to track everything. Just track like a VAS. Track like the patient and the type of surgery that you did. Because, you may adopt a new technique, and after a couple of years, you may want to look back and say, well, they told me that, prone lateral is more efficient. Is it? Like, how am I doing? So, for me, I query my database and look at operative times, L4-5 single levels, and the last 5 years. And we can do that pretty simply now because we have that database flushed out. And all of that starts with, again, simple tracking. So we can look at the operative times, we can share this data with other people if they want to learn from our experiences, even if you want to quality control yourself. I think society and industry is interesting as well. I mean, we get this opportunity to share. Even if you're early in your practice, you experience things, endure things. You want to possibly volunteer for speaking engagements like we did just now. because everybody has something interesting to share, and we're all interested in sharing those experiences with each other. LinkedIn and social media is another platform I think that's great to continue the academic mindset. It's not traditional in the sense that it's not society or an academic center, but it's online. And people share cases, papers, thoughts, ideas. We shared our recent paper online. We had a bunch of comments, people thinking about it in different ways, and so that's stimulated. And then there's also the counterpoint to the paper, people who may not agree with the way that we present the data. And so this is all healthy, like the debate is healthy for what we're trying to do, which is ultimately improve patient outcomes. The mentor-mentee relationship may not be so visible when you're in private practice. You may not be around students or residents, but it can be enriching. And so there's still PAs to train clinically and surgically. I get a lot of satisfaction from that. We now have a full-time research fellow, which it's typically an unmatched orthopedic applicant, and that's helped our research program grow. We have orthopedic residents that rotate with us, and then, students, maybe not the traditional medical students, but there's always like high school students or undergrads that are looking to just have exposure to medicine. And during the summertime when they're free, you can invite them into your practice and let them experience the things that you do. Of course, intra and interdepartment meetings are important. Probably not at the frequency that happens in an academic environment, but we try to have something where we're talking business and clinical medicine monthly. And then scrubbing with your partners is always fun. It takes a complex case that could be stressful into more enjoyable case that you're doing with your partner, which is always a fun environment. And then lastly, outreach. Back in 2019, I made a trip to Africa. I was an HSS fellow and went to Ghana for 2 weeks, and that was like kind of life-changing for me. Since then, I go every year to like Mexico or Colombia or Brazil under the GSO umbrella. And so outreach work can be a method of staying academic as well. Seldomly you enter an environment where there's 4 very qualified spine surgeons all thinking about a single case. And so that could be very stimulating. It slows down volume and it really focuses on the patient. And it's a great way to give back and also to learn new skills. And so academically minded in private practice can mean lots of different things. We just touched on several, but it's definitely a topic that's very interesting to me, and I continue to enjoy like the exposure that we get just outside of clinical medicine in general. And I encourage all you guys to do the same.